So psychiatric medications aren't for you. What other options do you have? My name is Dr. Dutton. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent, while at the same time, the importance of approaching each individual in a holistic way, understanding that the biological, the psychological, the social, and the spiritual elements all play an important role in someone's mental well-being. So I've talked a lot about informed consent and what that looks like for a number of different psychotropic medications, and there are a lot of potential risks to our psychiatric medications. And while there certainly are cases where they're appropriate and you could argue even necessary, there are also a lot of cases where either it's not desired, it hasn't been tolerated, or it's not effective. And in these cases, medication may not be the answer for that person, or medication alone may not be the answer for that person. Well, obviously there's therapy, right? Most people know you can either take medications or you can do therapy, but there's a whole lot more than that you can do. In taking a broader biopsychosocial spiritual approach, you can look at all of the different areas of someone's lifestyle, their metabolic health, and target whichever of those areas need some work, because those things are all also crucial to mental health. Zoloft is not going to help you if your primary relationship in your life, your partner, your child, is down in the dumps. And it's just providing symptom relief rather than targeting the true cause of what's going on. So what are some of these interventions? I like to take a metabolic approach, which means that I basically look at anything that can affect your metabolism in a negative way, and those are all potential treatment interventions. So one area is going to be your diet. There is so much you can do as far as changing your diet to something that is going to be better for your mental health. There are things that I recommend to everyone, like cutting out ultra-processed foods, but there are also things that may be unique to someone, like eating with their hormones, trying a ketogenic diet, eliminating certain foods that are inflammatory for you. There's also exercise. We have studies to show that exercise is just as effective as antidepressants in treating depression. It's also going to help reverse all of those metabolic issues like insulin resistance and high blood pressure. And it gives you a natural boost of those endorphins and feel-good hormones, which help to lift your mood, alleviate anxiety, and help with focus. There's also going to be elimination of toxins. So this isn't just about microplastics and toxins in the water, heavy metals. It's about substances, right? Things like regular use of alcohol, of marijuana, of other illicit substances. And no, it's not easy to eliminate these things, whatever they are. It takes intentionality and effort and sometimes assistance from a medical provider. But eliminating these things is necessary to achieve optimal brain health. Then there's going to be stress management. When your stress is not managed, your cortisol levels are going to be high, which is going to increase inflammation. It's going to perpetuate issues of high blood sugar and insulin resistance, which is only going to perpetuate your metabolic dysfunction and your mental health symptoms. So integrating some kind of mindfulness practice or other coping skill that helps you to manage that stress is going to be a crucial component of a treatment plan. And then there's sleep. Sleep is so important for pretty much every mental health condition. If you are not sleeping well, you're setting yourself up for a mental health issue. Now, there are totally cases of treatment refractory insomnia where we need medication. We need to kind of like pull out all of our tools. But there are so many cases where some simple sleep hygiene tweaks can make a huge difference in someone's sleep quality. And along those lines, there's regulation of circadian rhythms. We are meant to be up, awake, eating, exercising when it's light out. And we are meant to be resting, digesting, fasting when it's dark out. But our society is not set up for this. It's normal to stay up late, to eat late night snacks, to be constantly exposing yourself to screens and blue lights at night. And this completely confuses and disrupts your natural circadian rhythms, which is going to impair your metabolism and negatively impact your mental health. And then there's elements of social connection. Like I mentioned, if you are isolated and you don't have those social connections, then your mental health is going to suffer. We are social creatures and we are meant to be in community with others. And being lonely and isolated is going to contribute to worsening stress levels and all the things that happen from there. And then spirituality, I think, is also a crucial component of this. I'm not saying that you should be religious or even spiritual, but being at peace with whatever spiritual state you identify with, that is also so important for mental health. And a lot of times this looks like healing past wounds. Maybe you've left the religious tradition that you grew up in, and this resulted in a lot of trauma, and that trauma needs to be dealt with. Or maybe feeling like you don't have a sense of purpose. All of these things are going to negatively impact your mental health. So if medications aren't for you, don't fret. There are so many other things that you can do. And these are not an either or. A lot of times I'm going to recommend thinking about these things and interventions that are needed in addition to medication. If there have been things on your mental health journey that you found really helpful for your recovery besides medication, then please share those in the comments below. I'm also putting together an email list for those of you who are interested in my content, because I may have future courses or offerings that I want to be able to communicate directly with you all about those things. So if that's you, send me a DM with your email, and I'll see you in the next one.